contraction, 3 to 5 contraction every 10 minutes. You must describe that in your history and your physical examination. Now, the next one is the passage. Is it clear? So, how do you describe the passage? You need to know that what in your history and physical examination, generally in the history, you may not describe the passage because the woman does not know her the 2 centimeter dilatation, different dilatation. So, it's on the physical examination I'm going to describe the passage. Is it clear? So, now to describe the passage, you need to bring out different elements. The passage is made up of 2 things. It is made up of the birth canal. It is made up of the cervix. The birth is made up of the cervix and is made up of the bones. Is it clear? The bony pelvis. So those are the 2 major elements which are made up of the level of the passage. Is it clear? The passage is made up of the cervix and is made up of the bony pelvis. Now the cervix. The cervix now, you can visualize the passage either from the cervix, so which is called cervical maturation, is it clear? Or you can visualize from the bony pelvis, where you are going to do the pelvimetry. So those are the 2 different things that you must visualize when you are working on with a patient that has that's in labor. Are you understanding? So now, when you want to visualize the cervix, there is a score that is used to visualize cervical maturation, which is called the Bishop score. Is it clear? This is score which is used to work with the cervical maturation, which is called the Bishop score. And now that Bishop score is going to have and is going to be counting till 13, and there are 5 elements of the Bishop score. Is it clear? There are 5 elements. The first element of the Bishop score is going to be the position. Is it clear? The position of the cervix. So you try to evaluate the position of the cervix. After evaluating the position of the cervix, we have now the consistency of the cervix. Is it clear? Now the position, if it is, we have the value can range from 0, 1, 2 to 3. Is it clear? So those are the elements of the Bishop score, vary from 0, 1, 2 to 3. For the position, if it is posterior, it is 0. If it is mid position, it is 1, and if it is anterior, it is 2. For the consistency, if it is firm, it is 0. If it is medium, it is 1, and if it is soft, it is 2. Then after the consistency, the third element inside the Bishop score is going to be so after feeling that it is consistent, we now evaluate for the cervical effacement. Is it clear? Now for the cervical effacement, if it is less than or equals to 30% effaced, it is 0. If it is 40 to 60% effaced, it is 1. If it is 40 to 50%, it is 1, or 40 to 50%. If it is 60 to 70% effaced, it is 2, and if it is more than or equals to 80% effaced, it is 3. Is it clear? So those are the different for the effacement. Now the next one is for the dilatation. Is it clear? Now generally, if the dilatation is close, if it is close, it is 0. If it is 1 centimeter dilated, it is 1. If it is 2 centimeter dilated, it is 2. And if it is 1 to 2 centimeter dilated, if it is 1 to 2 centimeter dilated, it is 2. If it is 2 to 3 centimeter dilated, it is 2. So 1 to 2 centimeter is 1, 2 to 3 centimeter is 2, and then if it is greater than or equals to 4 centimeter dilated, it is 3. So that's for dilation. And then the last one now is the station. Is it clear? 0 is going to be -3, then 1 is going to be -2, then -1 and 0 is going to be 2, and then +1 +2 +3 is going to be 3. So those are the different elements that you have to have in a Bishop score. And now when you have a Bishop score, if you have a Bishop score now which is greater than or equals to 7, it means that it is a good cervical maturation. Is it clear? But now if you have a Bishop score of less than 7, it means that there is a poor cervical maturation. So those are the different elements that you must bring out when you are working with a patient that is in labor for the passage. Is it clear? Now the next element of the passage is you are supposed to speak now about the bony pelvis. Is it clear? Every time you are evaluating a patient that has And also, I've forgotten another element seen in the cervix after evaluating for the bishop score. There are other elements that you can do still while doing a vaginal examination. You can visualize for the caput. Is it clear? The caput is actually the external os that you visualize. Is it clear? External os. There are sometimes you need to know that the caput, there are sometimes that there is going to be a formation of a very huge caput without any dilatation. Is it clear? And that is a probable diagnosis for for obstructed labor. Is it clear? When you have an obstructed labor, you are going to have a huge caput without any cervical dilatation. It means that that one is an obstructed labor in the case of a cervical dystocia or in the case of a contracted pelvis. Is it clear? So those are the different elements that you must have in mind. Now the next one, we have bony pelvis. So the bony pelvis, now when you have the bony pelvis in front, and in this case you are going to have the cannular sign. I forgot to say that when you have a cervix with a caput and the caput is going to be very huge. And when you do the vaginal speculum examination, another thing that can make you guess that it is a contracted pelvis, you're going to have the cannular sign. Is it clear? So I'm going to tell you on the comments what is the cannular sign. The next one is the bony pelvis. For the bony pelvis, we need to visualize that word. To visualize a bony pelvis, you need to do pelvimetry. Is it clear? And how is pelvimetry done? In pelvimetry, you try to measure the anteroposterior diameter. So is it clear? So the anteroposterior diameter is the diameter that is actually used in order to calculate pelvimetry. Is it clear? So that anteroposterior diameter corresponds to the obstetric conjugate, and the obstetric conjugate is absolutely very important when you want to work with obstetrics. So clinically, you can measure the obstetric conjugate, and also another element that you can measure is the transverse diameter. You can also measure the transverse diameter clinically.